Okay, so as you've seen, Shelley's back from surgery. The question really is, how successful was the surgery? And to a large extent, was it necessary? How bad was the arthritis in the bone? And when the surgeon came in, he did explain that it was much worse than they had originally anticipated. And the reason it was much worse is because neither the X-rays nor the MRI scan showed the extent of the damage to the ball joint, and that's because the ball joint was damaged on the top. He said it was damaged so much that he'd actually taken pictures of it and was going to show it to other people to help them learn why you can't necessarily just go by the MRI or the X-rays. Now I'm going to show you that and explain to you what exactly was wrong with the joint. But again, he said to us, if you're squeamish, don't look. And I'm saying to you, if you're squeamish, you might want to fast forward over this video or even perhaps stop watching it. So I'm going to give you a little warning. We're going to go to that picture in 5, 4, 3, 2, 1. Let's go. Okay, so here is Shelley's hip as it was recently taken out of Shelley. And you can effectively see that the top here is completely ragged. The surgeon suggested to us that it actually should be looking much like the end of a ping pong ball. So effectively it should be looking like this, and it looks like this. So the covering on the bone should be really nice and smooth. And you can see here from the picture, and it's not very high resolution, that the whole top of this bone is ragged. It's not smooth. There's not a lot of meniscus on it. The cartilage effectively is completely gone, and all of this was actually slamming into the socket joint and causing Shelley a huge amount of pain. So you can see from that the damage to the very top of the joint was quite excessive, and that just is not visible with an MRI scan because the MRI scan's looking through sideways. And if that's the case, then the surgeon or the doctors can't tell exactly how bad it is. Now, because of that, the surgeon said, look, I do apologise, we should have done this much sooner. And he'd taken a picture particularly to show NHS hospital doctors that you can't necessarily trust the X-rays or the MRI scan. Because in the NHS apparently, and we're very fortunate to have been able to do this privately, but in the NHS, if you see what you'd seen in the pictures for Shelley, they'd have just said, no, we can hang on, no, we can hang on, no, we can hang on. So you might have been in that complete agony for months or even years before they thought it was bad enough to actually have it done. So it's nice to know for Shelley that it really was necessary, and in fact it was necessary long before she actually had it done. Okay, so the good people on YouTube land, if they've been not squeamish, have now seen the state of your ball joint, of the ball at the top of your femur. When the surgeon came in and said, look, it was really bad, we didn't realise it, how did that make you feel?
Relieved, because the MRI had shown that actually it wasn't very bad, and he said, well, you know, yes, you've got some arthritis, but it doesn't look really bad. And I was in so much pain, I just felt like I was a wimp and I must be making a big fuss over nothing. So it was a real relief actually to know that it really was that bad, and that I hadn't been making it up.
he actually, I mean, it was nice that he said that he was going to use that picture. He took the picture particularly because he was going to use it in NHS hospitals and NHS teaching to show that even if the X-ray and the MRI don't look bad, it can be particularly horrendous.
Yes.
I mean, he actually said to you, didn't he, that you did need this operation, you did need it now.
Yes, he said, in fact, he felt bad for me that I'd had to wait this long to have it, but I couldn't have it earlier because of the cortisone injection, and you can't have the operation straight after a cortisone injection because your immune system is suppressed, and so it would be a bit dangerous. So he said, yeah, he felt bad about it.
And his reasoning for that, for doing the cortisone injections, were perfectly normal because they're not seeing a phenomenally bad X-ray or MRI, and they want to go through the stages to make sure that
they want to try everything before they operate, because this is a major operation. you know, the impact it has on your life is quite extreme. So they want you to try everything before you do this. And the cortisone injections can work. They can give people relief for actually quite a long time. So it makes sense for them to do that.
So I think we take from this to a large extent that everyone's an individual, and every case is an individual.
Yeah.
And if you really are feeling pain, it probably is an indication that your situation is worse than you might think.
Yes.
So over the next couple of days, the next couple of videos are going to be about the physio and hydrotherapy that Shelley experienced in hospital. That's quite interesting, so keep watching. Remember, subscribe and like, and we'll keep on sending these videos out as Shelley recovers from this major procedure operation.